The people with diabetes have essentially high blood sugar in their bloodstream. And this can occur for two main reasons. One is because your own body is not able to sense this hormone called insulin that is traveling through the bloodstream, telling you to remove sugar from the blood and use it as energy. The remaining people with diabetes are people with type 1 diabetes. This is a very different type of disease. It's an autoimmune disease where your own body thinks that the beta cells that produce insulin are like a virus or a bacteria, foreign. And so your own body is attacking and destroying these cells.
There's two real, I guess, treatment options. One is one that's fairly well established, which is solid organ transplant. And then also one that really is sort of what we're looking to improve on, which is islet cell transplant. The beauty of islet cell transplantation is it's really kind of one of the most minimally invasive operations that we can do. We've sort of recovered the insulin or the glucose regulating cells within the pancreas, discard all of the exocrine or digestive function of it, and take those cells and then infuse them into a patient.
The dream that we have as stem cell scientists is that we can actually create an ad hoc islet, a surrogate islets that maybe one day we will be able to transplant them without immunosuppression. And this is through the use of bioengineering technology or genetic engineering technology to make sure that these cells will not be recognized by the immune system. And so if you think about that, then you could potentially have a source of islets that come from stem cells, so it would be unlimited. So you don't have to worry about, looking for the perfect match or looking for the right donor, or enough donors for everyone with diabetes. And also, you'll have the consistency that all the batches of cells would be the same. And this could guarantee effectiveness in the future. This is actually something that we started to think about a few years ago, because obviously what I'm doing in the lab, the basic science, needs to be translated to the clinic. And so our long-term goal is really to collaborate with the Ajmera Transplant Center to launch a clinical trial here in Toronto.
As Cristina mentioned, the challenge really is to bring this to patients. And being one of the largest transplant centers, we have access to lots of patients that are really in need of transplant. So that's sort of the main role that we play in trying to find a cure for this.